Imagine having 4 illnesses: a cancerous tumor, AIDS, tuberculosis, and a spinal injury, all clamoring to debilitate you. You are in constant pain, when even at the highest doses of pain medication available at the hospital, your pain levels are so high that you cry out in pain. Yet all you wish for is to stay alive just long enough to see your yet-to-be-born first child. This is a story of a patient, nay, a brave man that I met 3 years ago. I had a couple of years of clinical practice under my belt, yet his case proved to be a challenge, one that my colleagues and I had never had to deal with before. I remember questioning the wisdom of his admission, as he would have been better taken care of at a larger, better-equipped referral hospital nearby. I remember having numerous meetings with consultant colleagues on the best approaches regarding his management. The decisions made did not sometimes yield an effective outcome for him. I remember taking time with one of the doctors to reassure the assigned nurses about his management and proper administration of his medication. I remember having to rush multiple procurement processes to get him medication that heretofore had not been considered as a stock item at the hospital pharmacy due to lack of demand. I remember feeling defeated at times because despite our best efforts, despite him being on the highest doses of available pain medicine, the team was barely able to control his pain. All the available avenues at our disposal were used to improve his quality of life. He managed to hang on valiantly and was able to see his first child. He sadly passed away 3 months after his child was born. His experience reminded me of a quote from Khalil Gibran that says that out of suffering have emerged the strongest souls. The most massive characters are seared with scars. This experience changed the course of my professional path. I became aware of the gaps within the public healthcare system with regards to chronic pain management. Available resources are rarely centralized, and access within public health facilities are minimal. With a growing population of 45 million plus Kenyans, 6% of whom are living with HIV and AIDS, and of these, a 75% co-infection rate with tuberculosis, my patient's story is one that is replicated in many public hospitals in my country. An estimated 20% of the adult global population lives in constant pain, and another 10% are newly diagnosed annually, which makes this a growing public health concern. The impact that it has on the family and on a larger scale, the economic productivity of a country is large. I believe there needs to be a place within the public healthcare system where the study and management of pain can be done, a place where accessible, quality, patient-centered care can be provided, a state-of-the-art facility that will use the latest advances in medicine, a place where every Kwamboka, Wanjiku, or Ochieng can walk in and be served by specialized personnel. I believe that through collaborative efforts within the Ministry of Health, key partners and institutions across the globe that have specialized in the area of pain management, this idea can become a reality. To have a pain management institute, a first of its kind in the public Kenyan healthcare system. To quote George Orwell, "Of pain you could wish only one thing, that it should stop. Nothing in the world was so bad as physical pain. In the face of pain, there are no heroes." Thank you.